following lab findings is most reliably positive for the primary cause of this illness? Okay, there's a 6 man. He has abdominal discomfort and malaise, but he has a fever, night sweats. Physical examination shows an enlarged spleen, mild tenderness, pale nail beds. So there's pallor. There's mild tonsillar erythema. Pulmonary examination will show scattered crackers. CBC shows anemia, thrombocytopenia, and leukocytosis with lymphocytic predominance. Bone marrow aspiration is scheduled based on PS findings, but it is inconclusive due to low yield. Is admitted to the hospital due to anemia, and a PRBC is given with wide spectrum antibiotics, is released the next day. And but which of the following lab findings is most reliable? So we need to have, right, of course, so we have a diagnosis. Okay, now can someone, since we already have someone saying it's hairy cell leukemia, can you tell me why is it not infectious mononucleosis? Right, because we have hepatosplenomegaly, we have night sweats, we have fever, he has tonsillar erythema. All right, see, so all of you are right. Yeah, okay, right. So monogamous, right. So he is monogamous. That is one point. The patient does not have a peripheral blood smear finding, although they have not mentioned the peripheral blood findings, smear finding, but based on those findings, a biopsy was indicated. We do not do a biopsy if we're suspecting infectious mononucleosis, so that rules it out. Then there is no lymphadenopathy, correct? Yeah, I guess that is there's significant thrombocytopenia, but that will be seen as splenomegaly, so that is not significant. Okay, so in this case, we have hairy cell leukemia, and the very specific buzzword for hairy cell leukemia is TRAC, that is tartrate resistant acid phosphatase test. Okay, CD25 is not significant whenever you are dealing with non-Hodgkin lymphomas. Don't worry about markers. There are just a few specific markers that will come in CML, ALL, and all. Remember those. Just forget it. There is not. We don't need to do rapid streptococcal antigen because it is not an acute illness. There is no pharyngitis, and there are many other more factors indicating against. TB does not present this way. Rest we have discussed. All right.
Thanks for watching. Please give a thumbs up and subscribe for more.